to fight this pandemic. Lord Almighty, we pray for those that have been affected, those that have been infected. Lord, we pray for those families that lost their dear ones. And we also pray that, Lord, you will repose the souls of those that have departed in your kingdom. Mighty and loving Father, continue to give us peace, stability, and prosperity as a country. We continue to commit ourselves to you. We pray for those that, Lord, love this country, and that, Lord, all the people in this country will continue to love this country. And we commit ourselves to steer this country to a greater height.
May we continue praying. Bismillahir Rahmanir Rahim.
Go to the tribute to the fallen COVID-19 Kenyans. And now we go into the remarks by several speakers before finally His Excellency the President will be able to open the conference for us. And please, those who are making the initial remarks, a maximum of 5 minutes. And we begin with our Cabinet Secretary, Ministry of Health, Honorable Mutai Kagwe.
Thank you very much, Governor Kibwana. Your Excellency, the President of the Republic of Kenya, Honorable President Uhuru Kenyatta, the Chair of the Council of Governors, Honorable Wycliffe Betsa Oparanya, the Council of Governors, Cabinet Secretaries, Principal Secretaries, the Ambassador of Japan, Secretary General, Mr. Mbasi, representatives of the various development partners present, distinguished guests. Your Excellency, it is a great pleasure to have this opportunity to make a few remarks during this auspicious occasion of taking stock of the country's COVID-19 response and challenges, and to recommend strategic policy measures going forward that can be adopted in readiness for any future pandemics, and to continue in the current situation because the pandemic is still here with us. Your Excellency, may I from the outset thank you most sincerely for the guidance, stewardship, and leadership and the way you brought us together during this very challenging period. I also want to take this opportunity to congratulate the Council of Governors, not only for the arrangement of this particular conference, but also for the cooperation that we have experienced since this pandemic broke out. And I would also like to take this opportunity, Your Excellency, to thank our partners, and on behalf of the National Emergency Response Committee, I would like to express my heartfelt appreciation to the international donors, business and philanthropic communities who, along with the countless Kenyan, have lightened our burden through monetary, in-kind, donations of skilled services, and say thank you to each one of them. Your Excellency, since the first reported case on the 31st of December in 2019 in Wuhan city in Hubei province in China, and the spread across all the countries, to date reporting over 24 million confirmed cases and 800,000 deaths have been reported. To date, Kenya has reported 33,016 confirmed cases, including some 19,296 recoveries, and unfortunately, 564 deaths of COVID-19 across all the 47 counties, with Nairobi accounting for slightly over half of the cases recorded. Among the reported cases, some 920 are healthcare workers, with 16 mortalities in 35 counties. Your Excellency, in order for us to be ready for the pandemic, the government, in close collaboration with the county governments and other stakeholders in the health sector, undertook a number of measures. First, in order to coordinate the response, the Ministry of Health established the COVID-19 National Task Force early in January 2020 to provide stewardship of the preparedness activities in readiness for the pandemic. The COVID-19 National Task Force developed the COVID-19 Contingency Plan, which was endorsed in early February 2020. This plan helped guide preparedness measures before the first case was reported on the 13th of March 2020. Later, on February 28, 2020, the government adopted a whole multi-agency approach in accordance with the Executive Order 2020 issued by Your Excellency that constituted the National Emergency Response Committee, which was cascaded to the sub-county and county levels. Your Excellency, to provide daily situation reports that inform the planning, the Public Health Emergency Response Center was fully activated. In addition, each county has teams of rapid responders and contact tracers on standby to investigate any alerts and follow up on contacts of confirmed cases at the sub-county level. Further, the Ministry of Health has consistently reviewed status of COVID-19 pandemic in line with the International Health Regulations 2005. The country has also scaled up diagnostic capacity to a total of 33 public and private COVID-19 testing laboratories across in 12 counties to improve access. These are also mandatory screening of cargo vessels, crew at all points of entry, and to minimize the risk of importation of additional cases from other infected countries. Stringent protocols have been put in place to ensure that the situation remains under control. Further, the restrictions continue to remain in force with a countrywide dusk to dawn curfew, which began on the 26th of March 2020. Your Excellency, with regard to isolation and quarantine capacity, there are now 7,411 isolation beds and 312 ICU beds across the 47 counties. And this continues to be improved, and every day we get additional developments of the improvement of these facilities. This infrastructure is expected to contribute towards achieving universal health coverage and medical tourism beyond COVID-19 pandemic. In addition, the ministry has distributed over 24,000 complete personal protective gear from the ministry and a further number of an equivalent number from donors. Further, the government has fully engaged in Bakumi initiative committees to support outbreak response measures. The ministry is utilizing the community health volunteers to enhance the COVID-19 detection, reporting, contact tracing, and especially, Your Excellency, in the management of home-based care, which is a critical part of the management of this disease. Your Excellency, as I conclude my opening remarks, let me just say that the government has implemented multiple strategies to limit person-to-person transmission of COVID-19 in the country. These include all the measures that have been taken, including the closure of learning institutions, and so on and so forth. And this will be spelled out better when we come to the detailed discussions within the next program of this conference. And in addition, we are also enforcing further measures that are going to ensure that we control and contain the disease. Finally, Your Excellency, recognizing the call by the World Health Organization to find one vaccine for all to support the COVID-19, Kenyan scientists in the country have joined up with the others to be part of this global race to find an effective vaccine. May I also mention, sir, that the support that we have given the counties, including the initial conditional grant of 5 billion shillings into the counties, have gone a long way to ensuring that the structure of management of disease is further improved. Your Excellency, I want to thank my colleagues and to say that let's never forget where we were. When this pandemic started, we had 8 beds in the whole country. Today, virtually every county has got a higher capacity than the entire country had when we began this. And for that, I congratulate you, sir. I congratulate the Council of Governors. I congratulate Governor Oparanya and the rest of the team. I thank you. I submit. Thank you.
And now, I would like to invite Cabinet Secretary Eugene Wamalwa for devolution and assault to also make his remarks. And thank you very much, Honorable Mutahi Kagwe.
Thank you very much, Your Excellency, the President of the Republic of Kenya, Your Excellency, the Deputy President, Excellencies, Governors, and Ambassadors, and all our development partners present. May I take this opportunity to also thank the organizers of this very important conference on the resilience of our counties within the COVID-19 era. And the man in the hot seat, who's my colleague in charge of health, has elaborated on exactly what the government is doing. So I do not wish to belabor going into what we have been doing, because he has been leading the process. Mine is just to hail the good intergovernmental relations that exist in our country, especially during this pandemic period. Indeed, when we are talking about resilience, Kenya is a very resilient nation, but never in the history of our nation has our resilience been tested to the extent that it has been tested during this pandemic. You will remember before the pandemic, we already had floods that had ravaged the country, displaced many people. Before the floods, we had the locust invasion. And before the locust invasion, we had drought. All these disasters coming back to back within a period of 1 year. Today, we're entering the 6th month of the period when we're fighting this pandemic, and intergovernmental relations at an all-time best. We want to thank His Excellency the President and the Council of Chair and COG team for the close and cordial working relations that we've had. Article 6 of our Constitution divides the Kenyan territory into 47 county governments, and it also requires that the 47 county governments work closely in consultation and in cooperation with the national government. It also requires that we hold summits at least twice a year to consult, for the 2 levels of government to consult. But within this 1 year alone, under the leadership of His Excellency the President, we have had more summit meetings than we've ever had since we started the devolved system of governance in our country. We've actually had almost 5 summit meetings, during which we have engaged and we have looked at this pandemic together, and we have adopted an all-hands-on-deck approach where we've been working together, and both levels of government have been represented in all the structures that His Excellency directed to be formed, where we've had consultations and we've had different responses being effected through the interventions that my colleague has reflected on. So this has seen a great improvement, but as we go forward, we'd like to see these continue. We've also, apart from the national level consultations, we've also witnessed consultations and interventions at the regional level through the regional economic blocks. And I want to hail these very good development. We have seen almost 5 meetings. The first was in April in northern Kenya, where we had the FCDC bringing together 10 counties, looking at the COVID-19 situation up north. And with national government and our partners participating, we were able to look at the region more intensely and come up with specific tailor-made interventions for that region. We did have a second meeting in May where we had the coastal counties coming together. And after that, we had the North Rift block also meeting. We also had the LREB meeting recently in Kisumu. And the reflections and the interactions and the partnership that we saw has indeed encouraged us to see how counties can come together to be able to pool the resources, to be able to look at the challenges within their regions, and to come up with a specific intervention. So we are happy with this, and we want to encourage this continued interactions. And lastly, we've also seen counties that are on the borders. We know that they have unique challenges, and we want to assure them of continued support from the national government. As my colleague has said, the 5 billion that His Excellency the President directed was able to reach every county through the Ministry of Health. Apart from that, we have also programs that we are running in different ministries. We have the Kenya Urban Support Program that is supporting the counties, also build up COVID-compliant markets. We also have under the Kenya Devolution Support Program through the Ministry of Devolution, where we are supporting the counties strengthen their health facilities and health services. And we are talking over 1.4 billion that was released earlier and 4.6 billion that is being released to help the counties build capacity. And we are looking forward to building a resilient nation. But the counties are actually the building blocks, because when we have resilient counties, we will have a resilient country. So we want to thank you and urge that we continue working together through this pandemic, but even beyond, because we know that there will be more disasters coming, there will be other pandemics coming. Experts are telling us that this is the terrible new normal that we have to live with. And we'll urge the counties to learn from the experiences we've had at this trying period, set aside enough emergency funds, as we've always talked about this, so that we are better prepared for the future pandemics, future disasters, to deal with them together. I thank you very much for your attention. Asante.
Thank you very much, Eugene. Part of the reality during this COVID time is we are also being supported by the international community. And now it's my pleasure to invite the Ambassador of Japan, His Excellency Roichi Orie, to also make his remarks.
Thank you very much, Chairperson. His Excellency Uhuru Kenyatta, President of the Republic of Kenya, and Honorable Wycliffe Oparanya, Chairperson of Council of Governors, Honorable Mwangi Wairia, Vice Chairperson, and all the governors and the cabinet secretaries, and Mr. Walid Badawi, UNDP resident representative. It is my great honor to say a few words at this important and timely conference on COVID-19 with the various stakeholders. Before I begin, I would like to take this opportunity to express my sincere and heartfelt condolences to all the people who have lost their family members, relatives, or close friends to this deadly virus. I would also like to express my gratitude to all the essential workers in this country, especially the frontline healthcare personnel, including the doctors, nurses, paramedics, and the support staff at the various medical facilities around the country. Ladies and gentlemen, today I'd like to address how Japan has stood by the people of Kenya in this prolonged war against the virus. As some of you well know, Japan's ODA to Kenya started in 1963, and since then we have shared a long history of cordial relations and cooperation. That includes our supporting the establishment of KEMRI in 1979, the institution which is in the forefront in the fight against this virus. I visited the institution KEMRI last week and reinforced the recognition of the importance of its work in the fight against the pandemic. Our recent support to Kenya to combat the virus includes the provision of chlorine to water purification facilities around the country by JICA to help mitigate the impact of COVID-19 through continued supply of safe water to Kenyans. In addition, 340 million Kenya shillings was disbursed through UNDP and UNICEF to strengthen the health sector and provide much needed medical equipment to hospitals. Indeed, this conference is also receiving support from the government of Japan through UNDP. Last week on Thursday, I signed the exchangeable notes titled Health Sector Policy Loan for Attainment of the Universal Health Coverage Phase 2 with Honorable Yatani at the National Treasury, amounting to 8 billion Kenya shillings. On the same day, I handed over PCR test kits with capacity of 50,000 tests to KEMRI through JICA, both of which will surely contribute to enhance the healthcare architecture of Kenya. Our support to Kenya does not stop here. We are planning another assistance in the very near future. I agreed with Honorable Yatani of Treasury to sign on this Friday other exchange of notes for 3 projects, including disbursing Japanese grant aid for the provision of medical equipment to over 10 counties in Kenya. And number 2, aid for the improvement of power distribution system in and around Nakuru City and around Mombasa City. And the total amount of 3 projects will be more than 3 billion shilling. All of them are grants. And in addition to those grants, Japan will provide 10 ambulances to Kenya through the counterpart fund to enhance the capacity of county-level healthcare system. Mr. President, I have one request. Please instruct your secretaries and the Attorney General to just do it on Friday. That's my request to Your Excellency. The wide range of assistance reflects Japan's response and commitment to Your Excellency President Kenyatta's call for joint cooperation with county governments to fight against COVID-19. Your Excellency, Mr. President, I'd like to take this opportunity to present good news for you. The Ugongo Road expansion project phase 2 in Nairobi, which was implemented by Japanese grant aid, was completed at the end of April this year. To promote strong, sustainable, and balanced and inclusive growth, and to enhance resilience of Kenyan society, as well as to contribute to the global efforts for SDGs. This project on Ugongo Road is one of the essential cases promoting quality infrastructure by Japan. One of the key hallmarks of Japan's infrastructure project is its distinguished quality. I think you have already realized the quality differences between Ugongo Road from Upper Hill to the end of Junction Mall, and road from Junction Mall leading to Karen. I would not dare name any specific country here, but I hope to see Your Excellency soon on the occasion of the opening ceremony at Ugongo Road. Ladies and gentlemen, all the governors, I'd like to assure you all, Kenyans, that this assistance is part of our seamless contribution to Kenya through friendship and partnership realized and approved in the time of difficulties. While taking precautionary measures against COVID-19, Kenya has chosen the path to move the country forward. I appreciate the Kenyan people's courage and the tireless efforts in this endeavor. I'd like to commend the government of Kenya and all the county governments in taking timely measures to contain the virus, and as a result was able to keep the infection rate very low in the country. Finally, I'd like to thank all those who have contributed and were involved in carrying out this meaningful conference. Sisi wa Japani tuko pamoja na wananchi wa Kenya. Asanteni sana.
Asante sana, Ambassador. Kumbe unajua Kiswahili. And we thank you for the support that you have announced, particularly to county governments. Thank you very much, sir. We now ask remarks from the Secretary General, United Cities and Local Governments of Africa, Mr. Jean-Pierre Elong Mbasi.
Thank you, Excellency, for having invited the United Cities and Local Government of Africa to this very important meeting, chaired by yourself, the President of the Republic of Kenya. Honorable Cabinet Minister, Minister of Health, Honorable Cabinet Minister, Minister of Devolution and Hustle, Honorable Chairman of the Council Governor, Ambassador of Japan, Resident Representative of UNDP in Kenya. I also want to convey, on behalf of the community of local and regional governments of Africa, the condolences of our organization to the people of Kenya, to the government of Kenya and to the county governors that have lost families, relatives, friends, due to this pandemic. I really commend Kenya to have embarked into this devolution governance. And Your Excellency, this was a right move, and it showed during this pandemic. You know how working hand in hand with the county government has helped the country to address in a very competent way this pandemic. And I heard the report by the Minister of Health on the way efforts have been made for each county to be able to address this pandemic and to save lives. I want also to commend you, Your Excellency, for the fact that Kenya is among the 5 countries that are doing the best in handling decentralized governance in Africa. But at the same time, Mr. President, I want to raise the issue of Kenya not having signed so far the African Charter on the values and principles of decentralization, local governance, and local development that you, head of state and government of this continent, adopted in June 2014 in Malabo. And we want to count Kenya among the first signatory and ratification of this charter. And I hope that this will be taken care of very soon. Let me also say that what is apparent in this COVID is that we lose sight of environmental health and hygiene, because COVID finally is an environmental disease. And it is very important that we bring back environmental health and prevention care on about preparing our local government and county government to handle the kind of pandemic that will still happen, the kind of hazard that, like the Minister of Devolution has rightly put it. Finally, let me also ask Your Excellency to pay attention on the fact that many of the county governments, and this is across Africa, many local governments will have a loss in their revenue of about 30 to 40% due to the home arrest, where many of our people were forced to be because of this pandemic. So we are asking you, Mr. President, to pledge, to advocate for the consideration of local government in the packages, support packages that normally both the national government and the international community will have to consider for the recovery of the economies and society. What also is important is that the compact, the social compact that everybody witnessed during this pandemic, give us an opportunity to renegotiate the way we will be building trust between the people and the public institution. And I think it is very important, Mr. President, that the county government be at the front line in the negotiation of this compact. And we ask that the local level, the subnational government level, be considered as the level that is the closest to the people, and where this new compact, this new social compact, will be best negotiated. I really want to commend your leadership, and I want to thank all the county governors for the effort they have put. And I want to mention that next year we will be coming to Kenya to celebrate the Africity Summit in Kisumu. And Mr. President, I want you to be prepared, because for the first time, the Africity Summit that you hosted in 2006 in Nairobi will be hosted in a secondary city, an intermediary city in Africa. This is a strong message we'll be sending, that it is the intermediary cities that are the bulk of urbanization in this continent, and that this is where we should start building the development of the continent from within. This is where we should start building the implementation of the Agenda 2063. I thank you for your attention.
Thank you very much, sir. And now, to represent the UN family, I ask the UNDP resident representative, Mr. Walid Badawi, to make his remarks.
Good morning. Thank you, Governor Kibwana, for giving me the floor. Your Excellency, President Uhuru Kenyatta, President of the Republic of Kenya, Your Excellency, Mr. William Ruto, Deputy President, the Vice Chair of the Council of Governors, Governor Wairia, the Secretary for Health, Honorable Mutai Kagwe, the Cabinet Secretary for Devolution and Asals, Honorable Eugene Wamalwa, the Ambassador of Japan to Kenya, Your Excellency Roichi Hori, the Secretary General of the United Cities and Local Governments of Africa, Mr. Jean-Pierre Villon Mbasi, Cabinet Secretaries here present, governors here present, principal secretaries here present, all development partners and UN colleagues, all protocols observed. It is really a pleasure to join you today on behalf of UNDP to give some remarks in this important and timely virtual conference as we reflect on the impact and the response to the COVID-19 pandemic in Kenya to build resilience. Let me also express my sincere condolences to all those that have lost family and loved ones in the fight against COVID-19. For the first time since 1990, global human development is on track to decline this year due to COVID-19. This is happening in the same year that marked the beginning of a decade of action towards the Sustainable Development Goals. As evidenced across the world and here in Kenya, COVID-19 has fundamentally changed the context of development. And what we face today is, as you have repeatedly called it, Your Excellency, indeed a war. COVID-19 has amplified the long-standing structural deficiencies in health systems impacting on the most vulnerable. Drawing on UNDP's global experiences with other outbreaks such as Ebola, HIV, SARS, TB, and malaria, we are helping countries to respond to COVID-19. Working with governments at the highest level, we are helping to mobilize resources and support the development of national systems for strengthening transparency and accountability in the response to this pandemic. For example, recently in Nigeria, UNDP supported the COVID-19 Presidential Committee to set up a resource tracking dashboard to ensure greater transparency in the use of public financing for the COVID-19 response. In Kenya, working within the wider UN family under the leadership of our resident coordinator, UNDP is accompanying the government and the people of Kenya in efforts towards eradicating poverty reducing inequalities, and building resilience to crises and shocks. On COVID-19, we are responding to the demands of our partners at both national and subnational levels, including ministries, the Council of Governors, county governments, the County Assemblies Forum, civil society organizations, and we are engaging the private sector on initiatives that aim to prepare, respond, and recover from COVID-19. This assistance is by no means exhaustive, but has included the following: providing frontline health workers in hospitals and medical facilities to counties most in need through our joint UN devolution program, supplying PPEs across various institutions, providing medical waste disposal equipment to some 13 health facilities, developing and communicating factual COVID-19 to Kenyan citizens in local languages, promoting innovative digital solutions, working with youth in the areas of health, food security, and dignified work, enhancing business continuity of government through also digital solutions. We are also collaborating with civil society organizations to protect human rights, promote gender equality, and access to justice. We are working with the peace architecture in the country to mitigate potential conflict that could derail progress towards the SDGs. In the area of socioeconomic recovery, we are supporting the National Socioeconomic Recovery Strategy, which is linked to Vision 2030, the Big Four Agenda, MTP3, and of course, the Sustainable Development Goals. We are conducting socioeconomic research to inform county-level recovery strategies and integration into the CIDPs, including financing instruments for their implementation. We have developed a series of policy briefs on the impacts of the pandemic and are currently technically leading the UN's socioeconomic response aimed at saving lives, protecting people, and rebuilding better. Your Excellency, we have an opportunity to build forward better and greener, to restore balance between people and planet, designing and de-risking nature-based solutions as part of a new social contract for the world. Kenya, I am confident, can emerge stronger from this crisis with more robust, transparent, and accountable institutions in all sectors. UNDP stands ready to continue supporting your government and the people of Kenya. We have, I believe, the collective expertise and the experience to look beyond recovery and towards 2030 together. Your Excellency, ladies and gentlemen, let us be reminded that the young people of this great country are its greatest asset as leaders, as change agents, and as innovators. We must make sure that we prioritize solutions that put youth at the center of everything we do, with them and for them, as we recover from this crisis. We commit to leveraging and working under the GenU platform that Your Excellency launched earlier this month, and for which you are a global youth champion. As I conclude, let me summarize 4 key messages. While I wish to congratulate the government of Kenya for putting in place robust COVID-19 management strategies that we have heard about earlier, and these have been critical in containing the spread of the virus and minimizing losses, both economic and human, we cannot be complacent. We must keep our foot on the pedal. 2, as the world seeks to build forward better, we must ensure that the SDGs and its core principle of leaving no one behind, particularly our youth and women, remain our compass in devising our recovery strategies. 3, let us be reminded that this is a moment for all humanity to rise above business as usual and deliver the most efficient response possible with the highest standards of integrity. Together, we will win this war, but only if we seize the opportunity to unite against a common enemy armed with the right strategy, as we learn from the lessons of others. In closing, I wish to acknowledge and thank the government of Kenya, our bilateral and multilateral development partners that continue to stand with the government and people of Kenya in responding to the COVID-19 pandemic, and who have entrusted UNDP to serve as an implementing partner for many of their programs. Specifically, I want to thank the government of Japan through the ambassador, His Excellency Roishi Hori, for enabling UNDP to support this important conference, as well as other COVID-19 response and recovery measures being implemented through us. We will continue to fight this pandemic and stand with you solidly. I wish this conference every success. Asanteni.
Thank you very much, Badawi. And now it is my honor and pleasure to invite our chairperson, Council of Governors, Governor Wycliffe Ambetsa Oparanya, who will make his remarks, and then he will proceed to invite our president. I had wanted to do that, but it is an honor reserved for our chair, and our chair will introduce our president. Oparanya.
Yeah. Your Excellency, Honorable Uhuru Kenyatta, the President of the Republic of Kenya, His Excellency Dr. William Ruto, the Deputy President of the Republic of Kenya, Excellency Governors and Deputy Governors, Cabinet Secretaries present, High Commissioners and Ambassadors, representatives of the national and county governments, development partners, private sector, international guests, fellow Kenyans. On behalf of the Council of Governors, I take this opportunity to extend my most sincere gratitude, first and foremost, to the President of the Republic of Kenya, His Excellency Uhuru Kenyatta, and to each and every one of you for honoring our invite and choosing to participate in this virtual conference. For the past 6 months, Kenya has been among the many countries of the world that is managing the COVID-19 pandemic. This virtual gathering today will provide us with a platform to collectively reflect on government's action in the prevention and control of COVID-19, discuss the impact of the disease that has had in our nation's socio-economic space, and recommend strategic and sustainable interventions that can be adopted by both levels of governments for this and for the future pandemics. Allow me, Your Excellency, to convey appreciation to you for the effort to bring the national and county government together with a view to forging coordinated national response to COVID-19. Thus far, we have held 3 extraordinary summit meetings, which have allowed the 2 levels of government to galvanize collaborative measures in the fight against COVID-19. Fellow Kenyans, more positive cases continue to be recorded every day. More deaths keep being reported. The nation continues to witness more despair and hopelessness owed to the closure of businesses, low incomes, and loss of livelihoods. Tourism, a bedrock of the Kenyan economy, has taken a huge blow from both domestic and international restriction of movement. Value chains that guarantees production and sale of agricultural products have nearly been paralyzed. Despite all this, we remain resilient nation. In the doom, let us be hopeful for a better future. COVID-19 has forced us to look forward, to look inward, and create a solution for ourselves. As much as the pandemic has shaken our systems, some good has come out of it. For example, Kitui County is now producing masks and personal protective equipment, PPEs. We have seen universities develop ventilators. Young people are producing locally made sanitizers and assembling ICU beds. Our working together has enabled us to achieve a lot towards the fight against COVID-19. Fellow Kenyans, COVID-19 has exposed the gaps and weaknesses that exist in our socio-economic systems and structures. The onus is on us, the national and county government, development partners, private sector, and civil society to devise remedial measures that will ensure every Kenyan's right to health care, food, shelter, and housing is guaranteed. Moving forward, we must act differently. That is why the Council of Governors commissioned the development of the county post-COVID recovery and reengineering strategy, a plan that will assist the sub-national level to adopt measures that enable it to prepare, respond, and recover from the future pandemics. Ladies and gentlemen, the Council wishes to thank our partners who have made it possible to have this conference. Specifically, a heartfelt thank you to the United Nations Development Program through the Japan government, the World Bank, and the County Pension Fund for supporting this conference. And to the Council Secretariat, thank you. Distinguished guests, I wish you a fruitful deliberations during this conference. Ladies and gentlemen, I now welcome His Excellency, the President of the Republic of Kenya, His Excellency Uhuru Kenyatta, to officially open this conference. Asanteni sana.
Thank you very much, and let me begin. Chair, Council of Governors, Governor Wycliffe Oparanya, all county governors, our dear friend from Japan, His Excellency Roichi Horie, the Secretary General of UCLGA, Pierre Mbazi, the UNDP Resident Representative, Walid Badawi, representative of various development partners, and all our distinguished guests, ladies and gentlemen. Let me once again say that it is with great pleasure that I open this virtual conference. And indeed, as I said earlier, I am particularly pleased that today's assembly is a congregation of solution givers and problem solvers. But let me also at the onset join all of you in once again extending my condolences to all those who have lost loved ones to this pandemic. Ladies and gentlemen, this conference brings together a multidisciplinary community of problem solvers, leaders, and a group of professionals and policy practitioners who have applied their minds to the COVID-19 pandemic for the last 6 months. I commend today, through you, Chair, the Council of Governors for bringing us together. This forum affirms the unique place of county governments in the structure of our governance and towards the realization of our national values, which includes public participation. Today's engagement brings together an assembly of our country's foremost brain trust on COVID-19. Everyone present here has agonized in one way or another in their area of professional practice over how to manage and eventually end this crisis. Many of you have experienced anxiety as you crunch numbers, rationalize models, and contemplate over what should be the best decisions for our country. Indeed, on my part as President, I have been called upon to make weighty decisions that presented the most unique dilemma to me as the head of state. More often than not, as I have indicated in my previous statements, the agonizing dilemma was one between two rights. Never before in the history of our nation has a head of state been called upon to invoke the Public Health Act and issue containment measures that would significantly affect the enjoyment of various liberties, rights, and freedoms of our people. And so today we gather here to harvest the results of these collective experiences and together chart a way forward for our nation's future. We are here to collect and build on the best practices that we have all recorded in the last 6 months. So today, if you are the custodians of best practices in the fight against COVID-19, you must remember that best practice is never implemented retrospectively. It must be applied instantaneously. Timely and instantaneous implementation of what has worked is what will take us forward and most significantly secure the gains that we continue to make. But as we implement best practice after counsel of this conference, our shared goal must also remain in sight. And this goal is simple: victory over COVID-19 and nothing else. And we must achieve it with zero option. And to achieve it, we must begin by building positive resilience. We must move away from tactical response to this pandemic to strategic response. Instead of symptomatic reactions to this crisis, we must move to structural reactions that are long-term and transformative. And this is what I call positive resilience. Being able to anticipate the patterns of this pandemic and responding to it transformatively and building back better. Ladies and gentlemen, allow me now to suggest a framework for banking your experiences of the last 6 months in this conference. This framework has 3 elements. First, I want us all to do a post-mortem analysis of how we have handled the COVID-19 crisis 6 months after it began to manifest itself in our country. Begin by looking at the forecasting of the spread of the virus. If all our models had projected severe scenarios that did not happen, was it because we were forewarned, or was it because of the swift interventions that we put in place? How does our national response compare with others within the region, the continent, and the world? Is there something that we could have done better? And are there lessons we should carry with us to the strategic phase of this war? Ladies and gentlemen, and I'm not asking you to ponder these questions because we have failed. To the contrary, I believe we have done remarkably well, and that is why we have begun to flatten the curve. But to do better, we must remain brutally honest with our approaches because intellectual honesty is critical to building resilience going forward. Ladies and gentlemen, secondly, after doing a post-mortem analysis, I invite you to do some in-mortem analysis. Ladies and gentlemen, we are in the middle of a crisis, as you all know, and we must analyze as it unfolds and changes form. The good news, though, is that in the middle of this crisis, the curve is beginning to flatten. However, we must not celebrate this happy moment too soon, but rather celebrate it with a great deal of caution. More so because the curve begins to flatten after it reaches its highest point. This point is also called the inflection point. And it is the most dangerous point because the curve can either flatten and de-escalate or take an upward surge. My appeal to all of you as experts, practitioners, and leaders is therefore to deliberate on our in-mortem condition. Although the curve, as I said, is beginning to flatten, could it surprise us by taking an upward surge at this inflection point? My third invitation to you, ladies and gentlemen, is for you to do a pre-mortem analysis. This is about early warning, but more fundamentally, it is about long-term response. If indeed we are to shift our response from tactical to strategic interventions, we must do a simulation of how this will work. A shift from symptomatic response under Covid-19 to structural response under universal health coverage must be well thought out. How, for instance, will the environment respond to this shift, and what are the enablers and disablers of this undertaking? Pre-mortem analysis will help us chart the path to sustainable health provisioning for all. Using this model, the conference should therefore give us counsel on how to promote preventative medicine over symptomatic care. It should guide us on how to use the lessons learned from the COVID-19 experience in order to anchor the full national rollout of the universal health coverage, one of the pillars of my administration's agenda for the nation. But most importantly, this conference of leaders, experts, and stakeholders should use pre-mortem analysis to guide us on how to build positive resilience out of the COVID experience. We must use this experience and lessons learned to build back better and to create a society capable of absorbing shock and emerging on top. But most critically, a society which unites when called upon to do so in the face of such a monumental challenge. As I conclude, I challenge all of us to reflect on how we can position our country to emerge as a stronger and more responsive state from the current pandemic. And with that, ladies and gentlemen, I want to wish you all very productive deliberations and, more importantly, look forward to your counsel on the steps we could adopt to conquer this invisible enemy going forward. It is now my pleasure to declare this conference officially opened. I look forward to participating and to offering some concluding remarks. I thank you all, God bless you all, and may God continue to bless the Republic of Kenya. Thank you, asanteni sana.
Very much, Your Excellency, for that speech and also for opening our conference. But I will request that you stay on briefly because I know you have a lot of work and you are a busy person. We have a video that is coming up on the COVID-19 county government experiences. So you watch that, it's just 2.5 minutes, and you will be able maybe to release you, and we expect you early afternoon so that you can also close the conference for us. Otherwise, thank you very much. Now,
I help women find independence by training them in fish farming. It's tough on my back, joints, and can cause headaches. Panadol Extra relieves multiple types of pain.
If symptoms persist, seek medical advice.
When you buy a bar of Cadbury Dairy Milk chocolate, you can help change the story. That's because we will use part of the proceeds to donate milk to less fortunate children across our beautiful country. Let us come together and
Those of us who are just joining us, I want to welcome you to the COVID-19 virtual conference. My name is Adele Onyango. I will be your moderator for the next panel, a very important conversation. And we're about to dive into just talking about our preparedness and response to COVID-19. Ultimately, we're going to be reflecting on the past 6 months. So if you are following, and Twitter is your favorite social media platform, remember you can send through your questions for any of the panelists, or if you want to chime in on the conversation. The hashtag to use is COVID-19 Conference 2019. And if you are on Facebook, you can send through your questions as well on the Council of Governors KE. That's the official Facebook page. And those on our Zoom chat room, feel free to type through your questions. We will have a brief Q&A later on at the end of the panel. But to help me have this very important conversation, I have a brilliant panel, but we will start off by really looking at our public healthcare and emergency response, and the systems and what we need to redesign as we reflect on the past 6 months. What worked, what didn't, what do we need to change? And to start us off is Governor Mohamed Kuti, who is the chair of the Health Committee. Welcome. And I also have Dr. Githinji Gitahi, who is the Group CEO of AMREF Health Africa. Thank you so much for joining us this morning to have this very important conversation. I would like to start off with you, Governor Mohammed. Of course, when you engage with the various healthcare workers who really are the lifeline of this fight against this pandemic, I just want you to share, what do they say is working, what do we need to change, and also to speak to their very valid concerns around their safety. We've heard concerns around PPEs, risk allowance. So perhaps we could start with you, Governor Mohammed. What are your thoughts on that space? I think Governor Mohammed has dropped off, so we will move to Dr. Githinji Gitahi.
Can you hear me now?
Yes. Yes, Governor Mohammed, I can hear you.
Thank you very much. I would like to start by thanking everybody and His Excellency the President. I think the success of this country in terms of the performance is because of the way His Excellency the President had immediately taken leadership and formed the National Emergency Response Committee, which then cascaded to the counties, where the counties immediately formed the county emergency response committees. This actually brought together the leadership right from the top to the counties and even further to the sub-counties. Immediately also, Ministry of Health, I would like to congratulate CS Kagwe, because immediately several protocols were put together, and those protocols were immediately communicated to the counties, and beginning with the training. And therefore, our medical staff, who most of them had never encountered a pandemic of this nature, were able to be trained by the national experts who may have participated in Ebola and other similar highly infectious diseases. And within a very short time, we had county staff who had capability and training to be able to manage COVID-19. And therefore, that actually put us in a very good position. And secondly, there was the issue of, there was lack of everything, because this is a pandemic and every country was depending on its own, and travel has been closed. So the way the country immediately swung into encouraging its own resources to manufacture PPEs, face masks, even at the local level, and with the support of Kenya Bureau of Standard, had been able to supply the initial very crucial requirement for PPEs, and that also helped quite a lot. The fact that also that the county governments immediately swung into action to disseminate information through radios and local radios and create awareness in the public, and the daily briefing also from the Ministry of Health helped a lot to galvanize the communities or the country as a whole to focus on what are the preventive measures. And I think that also contributed a lot, combined with the fact that His Excellency the President took a very bold step of locking down the country and containing the disease in counties that had hotspots like Nairobi and Mombasa and the coast. That actually helped quite a lot. And I would like to say that we came out a stronger and a better country, and the result we are enjoying today are as a result of those initial right steps that we took. The other thing I would like to mention, and because His Excellency mentioned we need to compare ourselves, is the issue of remaining true to the people. We've not hidden any figures. We were very blunt and true to our constituents who are our citizens, and we followed. If there were deaths, if there were numbers, they were just only the challenge was the testing. I think what came out very strongly in terms of the challenges that we need to focus in future is our ability to test. And that is where now our research institutions need to rise up to the ability to produce testing, because this is a pandemic and it is anticipated due to climate change. Pandemics are bound to happen again. We need now to up our game as, and this is where now maybe the country needs to invest more in research stations, in research institutions, such that we are able to have participation in developing tests, in developing vaccines. I'm happy Kenyans are already participating in the development of vaccines, but I think we need to invest in research. We need to invest in our universities, and I think these are the comments I would like to make in terms of sector. Finally, also the issue of infectious disease in regional blocks. I know counties are developing regional blocks. It is important now that we be able to have regional infectious disease hospitals and research institutions at the regional level, because most different regions have different disease prevalences, so that those regions become expert in those diseases, such that if anything happens, then we already have expert institutions based in various regions of the country. That's what I would like to say. Thank you very much.
Thank you. Thank you very much, Governor Mohammed. I really do love that you brought up the issue about investing in research, which is a question that has come up on our chat room and also on Twitter for this conference. I want to bring in the issue of the curve, because we've heard the president shortly before just talking about the curve and flattening the curve. And it's a conversation that has been had over and over as we've been fighting this pandemic. So, Dr. Githinji, I could bring you in here. Speaking about the curve and the crucial point that Kenya is in now, what do you think are some of the things that we have been doing that we should keep doing? And what are some of the new practices that we need to be implementing now?
Thank you, Adele, and Your Excellencies. Appreciate everyone's presence, and also my personal condolences to my colleagues who have passed away in the front lines of this war. And also to appreciate in this flattening the curve, the response of the national government, the response of the Ministry of Health and the various different agencies, as well as the participation of the media, for the state, and our communities as well in this agenda of flattening the curve. Remember that we said, and we've said before, that the curve is as flat as your health system is strong. If your health system is very weak, then your curve has to be flatter, and therefore you have to suffer more socioeconomic disruption because you're trying to make sure that the curve is below the capacity of your health system. But as has been reflected on by others and Governor Kuti specifically, in terms of the early response, Kenya has done fairly well in this response. I remember many days and many nights with the National Task Force, colleagues from across different sectors discussing what to do and how to move on with this response. And one of the things that worked very well was the very early response, closure of borders, contact tracing. The initial response on the contact tracing worked fairly well, and the build-up to testing capacity, though it did not work very well with the counties, and I know counties are still struggling with testing. You know, I talked to one CEC who said they're waiting for results for 14 days. Wow. This is one of the things we must address. But the public health measures as well, the adoption worked very well in terms of hand washing, masks, and all those, in order to flatten the curve. Remember that flattening the curve is largely about reducing the force of transmission. It's reducing how many people one infected person can infect. And therefore, when we advise, and the government advise people to wear masks, to wash their hands, to social distance. That has played a big part in flattening the curve, and must thank our citizens for responding to that call. The other thing that worked very well is communication. You know, daily communication with the media being very, very involved in talking to the people, giving us opportunities to talk to the people, worked very well. And finally, collaboration also worked very well. We're seeing multi-agency teams at national level, at county level, also regionally with WHO, Afro, Africa CDC, and others working very well to assist this country. But there are things that do not work very well, and these are the things we need to reflect on within His Excellency's framework, also doing an in-mortem and a pre-mortem. One of the things we've seen is that obviously social disruption, and this has brought together many things. Some of those things, other than occasional abuse of human rights, and police brutality, we've seen rising FGM, rising teenage pregnancy, we've seen hunger. All these things have not worked very well, and I think they reflect on what has been said, that we have a weak socio-economic system. I think this is what Governor Oparanya was trying to say. The next thing is community ownership. We saw government leadership, but we did not see community ownership in the very early days. Governments are trusted so that their strategies are implemented, and we saw people actually wear masks because of the police. So these are areas that do not work well, and I think moving forward we want to ask ourselves, as the government leads the response and any other response in the future, what is the role of community ownership in actually making the response successful? The next thing we saw that did not work very well is centralized supply-based response, where we saw the national government and all these other agencies sending resources to the people, sending PPEs and sending all these things to the hospitals. And I think I'll respond, I'll talk a little about that, because it's very important that the response is based on the ground where the infections are happening. I think we saw a lot of counties waiting for money to be sent from national government. We saw hospitals waiting for money to come down from counties, whereas an emergency response is like flooding. Communities wake up and they find floods in their houses and they have to know what to do. This is the response that we want to build. And this was tied to the financial strategies that were more centralized and going down to the counties. So I want to say that COVID-19 has actually shown us that it's not enough to have a crisis response, what His Excellency the President called tactical response. It is necessary to also build the foundation of the underlying health system. And I want to mention key things that I think are really important in looking at the pre-mortem and how do we bounce forward instead of bouncing back where we were. First is we need adequate public financing. We need adequate public financing to healthcare. Right now, Kenya is spending less than 200 billion, combining county and national. And that, when you calculate, is going to be about $30, $32, $35 per individual, where countries in other areas, maybe middle-income countries, are spending up to $500, $800 per individual. High-income countries are at $4,000 per individual. So we need to think about public financing. Secondly, universal health insurance through NHIF, so that we put money in people's pockets through the NHIF card, and they decide where to go. And this needs to be based on an agreed benefit package that includes public health, not only secondary and tertiary care. And finally, that if you put money in people's pockets, you must then give the facilities facility autonomy and responsibility over the money. I always marvel at how much we give autonomy to schools through Board of Management to collect fees and to spend it. But when we come to health, we are told the Public Financial Management Act does not allow autonomy of facilities. Yet we give it in the education system with 24,000 schools. How can we clearly say we are not able to trust 6,000 public facilities to manage their own funds? This is something I want to look at through His Excellency, through Treasury. I know the CS of Treasury is here, and this is critical to the success of health system resilience. And finally, community-anchored primary healthcare with functional community units, with paid community health workers or facilitated community health workers, that makes us build a health system not only for this pandemic, but for the future pandemic. We must bounce back, we must bounce forward, not bounce back. If we don't take advantage of this crisis to implement UHC through NHIF, single, decisively, without stuttering and twerking and tweaking, NHIF, universal health insurance, starting with the poor, women, youth, the vulnerable, and then building up, we will not succeed in building a strategic response now and in future. We will remain dependent on tactical responses and all the challenges that we have seen.
Thank you.
Thank you, and back to you, Adele.
Thank you so much, Dr. Githinji. You did bring up quite a few pointers, and I'm so happy that the panel includes people who can actually put in actionable steps to some of the things that you've brought up. And I do echo your feelings on that we have to take advantage of this to learn how we'll bounce forward even post the pandemic. While reflecting on the past 6 months, we have to speak about the accountability and transparency. And because these are the tools that really build the public's increased trust in how the pandemic is being managed. And so to help me really dive into that part of the conversation, I have Ms. Wanjiru Gikonyo, who's the National Coordinator at the Institute of Social Accountability. And we're going to be getting to that in the next couple of minutes. So do stick around for that conversation. We also have Mr. Irungu Horton, who is the Executive Director of Amnesty International Kenya. And we also have Honorable Ndegwa Wahome, who's the Chair of the County Assemblies Forum. And I want to start off with Honorable Ndegwa. The public right now, we're feeling very helpless. The words used to describe misappropriation of funds are a certain amount has disappeared, which really diminishes the public's confidence in trusting that the pandemic is being managed well. So one of the reasons is there seems to be a lack of accountability when it comes to misappropriation of funds or just general mismanagement of the fight against the pandemic. Could you speak to why this is the case and how can we help build up the public's trust in this fight against the pandemic?
Okay, thank you very much and for having me at this particular time. And when I speak, I'll be speaking for the 47 county assemblies and our experiences in confronting this pandemic that is COVID-19. And what I would want to say at the outset is to thank His Excellency the President and the national government for the good work they have been doing around the COVID-19, despite everything that is said around the issues. At least good work has gone into fighting COVID-19. Also, the Council of Governors and the county assemblies in ensuring that at the county level that there is good work that is being done towards addressing the COVID-19 and mitigating the effects which are very grave to our people at the grassroots. But to start with, I would say that the infrastructure of accountability when confronting the COVID-19 has not been as elaborate as we would have expected. And you look at a casual look at what has been happening. You'll find that the national parliament, which is the National Assembly and the Senate, and also the county assemblies, which play a very critical role in oversight to ensure that public resources are used prudently. They are nowhere. I think you have seen statements being issued even by the Minister for Health, who is with us here now. Even when the Minister for Health is coming to the counties, you'll find that there is no representation of the oversight bodies at all. And therefore, these oversight bodies are the representatives of the people. They are the people who reach out to the common Wanjiku to know exactly what is happening about this fight. So the much that Wanjiku is getting to know is only what he or she reads in the newspapers, what they hear in the radio. But there is nobody within the oversight bodies who can go down there to Wanjiku to tell about information that they are not very conversant about. And on this, I'm saying that when you talk about transparency and accountability, it simply means that the lines of communication are very easy within the family of the stakeholders, like in a pandemic like the COVID-19. But as of now, there is a lot of misinformation on what is happening. When we hear that billions are being released from the national government, and then at the counties, when we inquire about these funds, we are told they have not been released. There must be mechanisms where monies that are being released to the counties, that we have very clear circulars, and the government has been doing that. We have a circular that in Nyandarua County, where I am the speaker, has received 50 million. The Vihiga County has received that 9 million. And that way, the county assemblies, and for the national level, the National Assembly will be able to interrogate these fundings and to know exactly where these fundings go to. We will appreciate that most of these fundings are never subjected to the fiscal process or the budget process within the counties. And therefore, also to oversight them is a very, very serious gray area. And when a member of a county assembly goes to the machinani, to the ward level, and cannot answer these simple questions about the billions that are coming to the counties, then there is a very, very big problem. Therefore, going forward, because here we have come to interrogate ourselves and to look at the mischiefs that have been created for the last 6 months, going forward, I think the National Assembly, that is Parliament, including the Senate, and the county assemblies should actually know what the right hand is doing so that the left hand can also be able to watch as per the constitution speaking to us, so that we are able to play our oversight role. Again, the same governments, even in the counties and also in the national government, the persons who have been executing the mandate of implementation of government programs are the same faces that are supposed to come and implement programs within the counties. As assemblies, we were of the thinking that at least every county should have been able to establish a human infrastructure of eminent persons to oversee the implementation of COVID-19. That one, over and above the assemblies playing oversight role, it would have ensured that there is confidence, even when billions are mentioned, that these are eminent people. These are people known in Nakuru that they stand out for what is right, for integrity, and they have done well when it comes to social engineering. And when such people are given that responsibility of dealing with COVID-19 response, I think there would have been a lot of respect for whatever is happening. Even some other issues, like the dealing with the COVID is an emergency. You will be told that some things were bought not at market rate, others happened this way. An emergency is dealt with, and most of the times, money, the value for money might not be the cardinal principle in applying even direct procurement. The cardinal principle is that maybe there is a life that is required to be saved at whatever cost. But these are issues that are never explained properly to the common mwananchi to understand exactly what we are doing as both the national government and the county government. So let the people who represent the voices of the common mwananchi be involved in implementation of these programs, even if it is pandemics. And finally, rule of law. Whatever is happening, let the people implementing and those oversighting look at the law, let the law speak to them, and we shall not have problems when we are dealing with this issue.
Honorable Degwa. On that note, I really do want to bring in Ms. Wanjiru Gikonyo, because this is really the work right down the alleyway of TISA. And I'd love to have you, Wanjiru, speak to what are some of the things government and institutions should do in increasing public confidence. Of course, Honorable Ndegwa has spoken on a few, and maybe you can add in some of the challenges in implementing these key ingredients to achieving public confidence.
Thank you very much. I'm grateful for the honor to address this important gathering today. On behalf of civil society colleagues whose contributions I will cite today, I wish to make an appeal for people-centered governance as the missing pillar in the fight against corruption. A 2018 assessment report of Kenya's procurement system by the IEA tells us that most of the solutions to Kenya's procurement problems do not require significant technical amendments to law, but a mere adherence to transparency and open contracting in Kenya. A mere adherence. The World Bank reminds us that accountability is the degree to which governments have to explain or justify what they have done or failed to do. More transparency in governance means less scope for corruption and dishonest behavior. With those thoughts, we then turn to the African Charter for Popular Participation in Development and Transformation, as prepared in 1990 in Arusha. This is also given effect through the African Charter on the Principles and Values of Decentralization and Local Governance and Local Development, as cited earlier by the SG. And the Charter identified the over-centralization of power as a key impediment to the effective participation of the people in social, political, and economic development. The over-centralization of power has severely constrained and curtailed the motivation of African people to contribute their best to the development process. The over-centralization of power in Kenya persists to this day, despite our constitution and despite the devolved governments, and it persists at both national and county level. The over-centralization of power has alienated the majority of people from their own development to such an extent that large sections of the population view the theft of public resources as a justifiable means of income. The problem of corruption, therefore, is rooted not in law, but in a collective social culture that tolerates and even encourages it. The African Charter, crafted at a time when the continent was facing social and economic crisis fueled by overborrowing, runaway corruption, similar to today, reminds us that, as a solution, nations cannot be built without the popular support and full participation of the people, nor can economic crises be resolved with and human economic conditions improved without the full and effective contribution of the people. The Charter calls for a drastic change in countries' structures and patterns of socio-economic development. This was reiterated again in April of this year by African intellectuals who called for a radical change and urged African leaders to think of the crisis as a symptom of deep structural problems that Africa has to confront if it is to become a sovereign actor in the new global order. So what does this mean for us in Kenya? The pandemic has taught us, as has been said very eloquently before, that countries with strong local health and food management systems fare best. Local health and food management systems. This calls for an increased investments through funding and appropriate decentralization. The Senate has prepared a community health bill, but we need to go further and look at the 2006 community health strategy. Look at similar strategies in agriculture and other devolved services that support resilience. From an accountability, sorry, I'll increase the volume, I've heard that.
Yes, yes, and I'll just ask you to just, be brief with your very important points now. Yeah.
Right. From an accountability point of view, we need to embrace open contracting to build trust, value for money, and such. In Slovakia, a government contract isn't legal until it's published. And this includes the milestones and the performance. We need to apply open contracting at every stage of the procurement cycle. Beyond that, in Makueni and Machakos, we are seeing project committees that are given oversight over procurement, and you cannot pay a contractor until local communities have approved and verified that the goods have been delivered. Governments need to work with civil society, county budget economic forums to institute procurement monitoring and social audits.
Thank you so much.
Transparency. Last point I'd like to make kindly is we need to look at the affirmative action programs such as the AGPO, which have become conduits for corruption. And we need to revisit them and ensure that governments are publishing the tender awards, beneficiaries, and the performances. We also need to look at programs such as the youth programs, Kazi Zamtani, and all of that, to make sure they are based on integrated environmental principles that support self-agency of youth and don't take an essentialist approach. We have actually piloted such a program in Makueni County, and there are other examples of the same.
All right, so I have to step in here, Wanjiru, because of time, and I want to ensure that, you know, the Kenyans who are watching this and definitely want to get their questions in at the end of the panel of the Q&A. And so I would just like all the panelists to just stick to about 5 minutes because of giving a chance to Kenyans during the Q&A to get their questions asked as well. I want to bring in Irungu. Of course, we're looking at the past 6 months. We're in a very crucial point. And what's maybe one or two things that you think need to be implemented now to increase the public's confidence? And now we're having the conversations around the public having lost confidence in the management of this pandemic. So I would ask that you just speak to one or two things that we need to implement and change now, and kindly maybe keep to about five minutes.
Thank you very much, Adele, and all protocols observed. Once again, thank you very much for the extension of this invitation to Amnesty International to speak this morning. Despite the omission of recognition by previous speakers, we welcome the participation of civic organization leaders in this conference. It is consistent with Article 1 of the Constitution and a whole-over-society approach. Allow me to take up President Kenyatta's invitation to speak with brutal honesty and an eye to building back better. Firstly, I think we should probably start with the understanding that the only framework worthy of our attention this morning is Article 43 and the right to dignified, affordable, safe, and non-discriminatory health. Last week, the polling company InfoTrack and Research Consulting released the Distressed Yet Defiant Opinion Poll that was commissioned by the Kenya National Commission for Human Rights and 8 human rights organizations. And these are some of the findings that have come back in terms of their conversations with the public. 30% of the population feel that the health ministry has handled the information flows to the public well. So I think this agrees with Dr. Githinji. There has been increased capacities in a number of counties. Murang'a residents probably have the cleanest of hands across the Republic. And in Mombasa, we saw a vigorous and energetic approach to leading by the county government in that case. And in many ways, I think during this time, it is clear that most Kenyans feel that the 48 governments, the 47 county governments and the one national government have handled COVID-19 better than East Africa, the East African neighbors and the rest of the world. 75% of the population 2 weeks ago associated devolution with improved development services. But this is the catch. 87% of the population associates devolution with increased corruption. And sadly, we now have added a number of new words to the English language: COVID billionaires, rela thieves, and onwards. 60% of the population feel that the curfew was brutally managed by the police. 17% feel that the forced mandatory quarantine program was mismanaged. And 15% want more action on runaway sexual and gender-based violence. And in this regard, perhaps more of the counties can learn from the Makueni Safe Houses program. I think in terms of thinking through, before I come to some quick recommendations, I think I'm on my second or third minute now. There were 3 systemic constitutional failures prior to the outbreak of COVID-19, and they have probably cost lives and the opportunity to flatten the curve much faster over the last 6 months. The first is the failure to devolve health fully to county governments. The second is the failure to roll out universal health coverage. And the third is the failure to introduce transparent and open government contracting, as been said by Wanjiru. So there are probably 4 or 5 general policy actions that I think we could learn from. The first is that, I think the wisdom that we had at the beginning of the COVID-19, particularly in terms of the cabinet decision to use the Public Health Act, not the emergency or the state of emergency procedures legislation, was critical, and it needs to be applauded. We now need to think seriously about abandoning the procurement-driven curative model in favor of preventative health and release the Ministry of Health's grip over finances to the county governments. Specifically on corruption, the cabinet must announce now a national emergency task force anti-corruption structure and strategy, which should include a bench of publicly respected internal auditors and the institution of several internal audits processes and systems. The Health Ministry must place all standardized costings, procurement tenders, contracts, bills of quantity, delivery notes, information on beneficial ownership, and payments on a public information portal. If we do not do this at the national level, then I do not think we are very serious about dealing with the threat of the more important C virus, and that is corruption.
Thank you. Thank you so much, Irungu. And I love how you've detailed everything very clearly, as well as with Wanjiru earlier. And the great thing about this COVID-19 conference is all the points you're putting across, the people who can bring these points to life so that we can see an increased level of trust from the public in how the pandemic is being managed are here. So I hope they are taking the notes and they are trying to see how these points you bring out can be implemented. We have to look, since we are looking back at the last 6 months and how Kenya has handled this pandemic, we have to look at the early warning system, right? And by the time we had our first cases, we had seen how it had played out in other countries. So then it begs the question, why was Kenya caught flat-footed? And to help unpack this and answer this very tough question, I have Dr. Rudy Eggers, who is the World Health Organization's country representative. I also have Honorable Mutahi Kagwe, who is the Cabinet Secretary in the Ministry of Health, and we have the Governor of Mandera County, Captain Ali Roba. I would love to start off with Honorable Mutahi Kagwe. We've seen the early warning system, the role it played, and as Kenya's approach to the public, this public war against this pandemic, what would you say, looking back on the 6 months, was a failure in the management of the pandemic? And being at this very crucial point as a country, what do we need to change to ensure this failure doesn't repeat itself?
Thank you very much indeed. Let me start off by saying that how grateful I am and appreciate the previous contributions that have been made, particularly by Wanjiru and Irungu, and to say that they had some good ideas which we will implement to start off, just to confirm that. Because sometimes when lies are told for long enough, they actually begin to sound like the truth. On the issue that is before us and the early warning system and why we were caught flat-footed, let me just say this. We were not caught flat-footed. Let me start from there. Because as my colleague who is here with me, and by the way, I think you skipped one item on 3. According to the program I have, you skipped number 3, which was on managing attitudes and behavior by Dr. Amos.
Yes, he's not
which
online.
I suppose you can go back to.
He's not online yet.
Sorry?
He's not online yet, but we'll definitely get back to him.
Okay, so I just wanted to say that first, we were not caught flat-footed. There was a lot of, as I had said during my remarks, I did point out to the series of events that took place prior to the first case that we got here in Kenya, all the way from the task force, the national task force being constituted in January. That is when they heard about the Wuhan experience. So in January, they made the task force. They developed a contingency plan. We developed a contingency plan. And even before the first case was reported, Like early in February, we adopted a whole government multi-agency approach because of the executive order that was given by the president. I think it is good to remember that the National Emergency Response Committee on coronavirus was constituted by the president before we knew that there was a case. And I remember saying to our people that it is not a question of if we are going to get a case in the country, it's a question of when we will get the case. So it is not entirely correct to say that we were caught flat-footed. We were not. But let me also put it this way. Let me also say this for transparency's sake. I don't think any country in the world can say without any fear of contradiction that they were completely and totally ready for COVID-19. I think that it took the world by storm. It is still taking the world by storm. And I think that it is important, even as I discuss this issue, to remember that the disease is still here. You know, the president spoke about what we are going to do.
We seem to be having a connection issue.
It is important for us to remember that we are still in it. We are
We seem to be having a connection issue with Honorable Mutahi Kagwe. We'll definitely try and get back online with him. And as we do that, I want to bring in Dr. Rudy Eggers, who's the World Health Organization country representative. And in terms of the information around the pandemic, every day we're learning something new about the pandemic. And sometimes what we learn tomorrow contradicts what we learned yesterday, right? How do you prepare people for knowledge that perhaps could contradict previous knowledge on the virus?
Thank you, Adele, and thank you also for this opportunity to speak to the Council of Governors and all the governors and the government of Kenya, and really to the people of Kenya. So clearly this is a global pandemic. It's the worst in a century. So I totally agree with CS Kabwe that very many countries, not only Kenya, but very many countries were struggling to actually be prepared in time and have enough information and preparation in time. Even the most prominent countries of the world were really struggling with this issue right from the beginning. If we look at the Kenyan response and the early warning system, I think there was very early awareness of this disease and the potential of this disease to really cause havoc in this country. There was initial preparation. I would point you to the fact that Kenya was one of the first African countries outside South Africa that had the ability to do lab tests. So by 12th of February, lab tests for COVID were being done in Kenya through KEMRI. So that points actually to the preparation and the ability really of Kenya to meet this challenge. Once the first case appeared, we had very rapid response with the public health measures instituted by His Excellency the President, and those measures were really informed both by the in-country laws and directions, but really also with the experience with Ebola disease and with the WHO guidelines that were behind them. So Kenya was among the countries that were most rapid in their response and their ability to really deal with the activities, the actions that are needed to counter this epidemic. I must commend CS Kagwe and really the Ministry of Health for the open communication. I think this has been a feature of the Kenyan response, that there has been a daily feedback to the population through the media, even though it might seem as if it's redundant. In fact, it allows the population and the media to come back again, to ask questions and to get the information out to the public. So I really commend the government of Kenya in being as open and as frank in their communication. Let me point out also and commend also the Emergency Operations Center. So there are a group of people in the background that really are working day and night to bring the data together, to analyze that data, to prepare it for our consumption. And really this is the backbone of our ability to respond to it. Equally, the laboratories, KEMRI and all the other laboratories around the country have really stepped up to the plate. So if you talk about preparation in Kenya, actually at the national level, it was rather well done. One more thing, I think Kenya was also one of the countries that, as the epidemic moved ahead, Kenya was one of the countries that really immediately established a committee that looked at maintaining basic health services. So being very careful not to lose the gains that were made by the universal health coverage pilots, not losing immunization coverage, etc., really actively looking at that as well. On the county level, there was some early awareness of the issues, especially in the larger counties, and some counties actually very rapidly responded. They prepared very well in this early period. And equally, unfortunately, it has to be said that some counties did not engage adequately. There are some areas that are not very well done at the moment, and I would highlight here that there are coordination issues at national level, between national agencies, between national and counties. There are also funding and operational funding issues. So in some cases, we know that things like the contact tracing teams don't have fuel to go and contact trace. Those kind of things are problematic. Also, of course, the ability by counties to collect data and to manage and transmit that data is really absolutely necessary to move ahead. Let me conclude. I think in the last couple of weeks, we've seen a declining number of cases, and already we can hear people starting to celebrate, saying, well, maybe this was the end of the disease in Kenya. Yeah. And well, I think from our perspective, I think it is too early to celebrate. As His Excellency the President said, I think we're still in the middle of it. We're still having to understand it better. And in fact, what we need at the moment is better data. We need better data from the counties, from the laboratories, but then also hospital admission data, mortality data. All these things would give us the ability to really follow up and make a very clear statement if the epidemic is flat-footed. At the moment, we would beg Kenyans not to relax their measures. Let us be careful, let us be prudent and not go complacent. There's still a disease out there, it's still killing people, and we need to be quite careful. So I would agree with CS Kagwe. Were we caught flat-footed? No, not really. I think Kenya actually did quite well. But at the same time, we need to recommit. We need to go back and recommit to meeting this challenge, meeting this disease. And I would, having the Council of Governors and the governors in front of me, I would ask you, your leadership is critically important. Your role model, your leading by example is really, really important. So I would leave you with that thought. Thank you so much, Adele.
Thank you so much, Dr. Eggers. I completely agree. It is an opportunity for us to really gather more data that could help not only with this particular pandemic, but you never know what the future holds, and data would help us prepare adequately. I want to go back to Honorable Mutahi Kagwe. I believe our connection has been restored now, and just to hear your thoughts looking back at the 6 months, what could you say could have been a failure, and how do we ensure that moving forward, the failure doesn't repeat itself?
Thank you very much, Andela. Now, I hope you can hear me now.
Yes.
I can't tell at what point. I know it says my internet connection is a bit unstable, but I'll try and be as clear as I can. And I want to take over. I want to take over from what Dr. Rudy Eggers has been working with us throughout this whole experience, because of the presence of the World Health Organization, sometimes having daily meetings at the Ministry of Health, and just to appreciate that their support, the World Health Organization support to the Ministry of Health, and to say that, we have a tendency as Kenyans of beating ourselves down perpetually. And I want to say that the experience we had all the way from the period prior to receiving the first case or accepting the first case, we actually predicted, and Dr. Amoth is sitting with me here, we actually predicted at what point we were going to get the first case and where this was one from. So by the time we did get the first case, we were quite ready to receive. We were ready to take them to Bagathi. And I want to remind you that we didn't have that facility before. We had to prepare it in 7 days. We prepared 100 beds in 7 days, you know, just to fast track our own capacity. The modeling projections that we have been doing and continue to do even today, we actually predicted what was going to happen round about August as we head for September, which is what we are seeing. We also looked at worst case scenarios. And worst case scenarios would have been terrible. We would have been following exactly the same pattern as probably Italy and Spain and so on and so forth. So the measures that we took in the initial stages, which were complete total government effort, is what to me helped us. And sometimes you can be also a victim of your own success, where because something did not happen, then you ask, why are you doing this? Why are you doing PPEs? Why are you getting all these things? Because you don't have cases and because you don't have 10,000 deaths. Why are you preparing, you know, for such an eventuality? Two things. One, we are not out of the woods yet. And I hope God keeps us at our level and possibly now diminishes the curve. But let's not also forget that we were told what to do, worst case scenarios, if we don't take measures. It is because we took measures that we are possibly where we are today. I think it is also important to talk about the additional capacity that we have now that will really help us as we move forward into after post-COVID on a UHC program. I like what the idea of prevention, the idea that what have we learned? What else could we do? How can this help us going forward? How can we prepare better for the pandemics that are obviously going to come at some point? One of them is that because of this, we want to fast track the formation of the Kenya CDC. We have been talking, the minister has been talking about it for a while, but now is the time to form the Kenya CDC. This week, we are discussing in the cabinet the policy document on health emergency responses. Because again, you don't want to have a situation like this arise, and that is a time when you start putting together the teams that are supposed to respond to a health response. So there are a number of things we have learned, and there are a number of measures that we need to take. The third one that I would like to mention is that we have also learned that prevention is an absolute necessity. Let's not focus only on cure, as somebody has just alluded to it. Let's not focus on cure, let's focus on prevention as well. The most important single item of public health is, we have discovered now, is cleanliness and hygiene. And we have seen a drop in the disease burden of some other diseases that are normally very frequent. The stomach issues, children's diarrheaing, and so on and so forth. These have come down substantially. And we have no doubt that it's because of the hygiene measures that we have taken. And therefore, going forward, we will be introducing things like a cleanliness index, an index through the Ministry of Health, where we will be announcing the cleanliness, the cleanest areas, the cleanest counties, etc., 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 as a huge government modus operandi on the way to increase prevention and deal with public health issues, so that we equally deal with the preventive measures as much as we are dealing with the curative measures. And I agree that on the issue of transparency that was alluded to earlier, I do agree that two things should happen. We should predicate a lot of what we are doing on ICT. If it is a question of procurements and tenders and so on, let them all be virtual. Let it all be on the screens of KEMSA, on the screens of the Ministry of Health. Let's post everything, for example, what we have explained about the use of money. Every day it is politicized, and we must also not be naive to the issue of the politicization and weaponization of the COVID issue, and that is a fact. We live in a country that is fairly political, and it is obvious that there is weaponization of the politics of it all. because it is the CS for health must and should and must continue to engage the executives in my parastatals. There is no way of gainsaying whether we are engaging KEMSA people, whether we are engaging KEMRI people, whether we are engaging the other ones. For example, as a measure of what we took, as of some of the preparedness measures that we took, we are the ones who told KEMSA they cannot continue importing PPEs. We developed individual national capacity for manufacturing of these things, and consequently informed, directed KEMSA that they must now buy locally instead of buying from overseas. That measure alone brought down the cost of PPEs from 9,000 shillings to 4,300 shillings and still going down. So when we say there is a politicization of these issues, it is a fact, and it is unfortunate when we are still in the middle of a pandemic. But I don't want to belabor that point. That's for another day. But I just want to thank the contributors and to say that the suggestions that we are getting are issues that we are going to implement. Some of them will be measures that we are going to implement. I submit.
Thank you. Thank you so much, Honorable Ntai Kagwe, for actually saying that some of the points that have been brought up by the other panelists are actionable points. And I do agree that transparency needs information flowing to Kenyans, even on how funds are used and even on the status of the country's fight against the pandemic. I'd like to bring in Governor of Mandera County, Captain Ali Roba. And I would love you to speak on things from a county level. There are very many ripple effects of COVID, and the next panel is going to unpack those further. But we can start by looking at how it has resulted in an increment in cases of gender-based violence. Livelihoods have been disrupted, and we saw that happen in other countries as well. So on a county levels, what are the measures that have worked to help cushion Kenyans against this and reduce this other vices, and which institutions need to help counties cushion Kenyans better?
Okay, thank you very much, Dele. I want to request to maybe add a little bit on the issue of early warning and also the issue of whether or not we were caught flat-footed from county perspective. And then thereon I can go into the second section of the question that you just posed. And I want to say first, even though it was not unique to Kenya, it is a global position, the early warning systems have not been effective. You know, I say this because we are just lucky that this disease outbreak happened in China, Europe, USA, and other areas, and that gave us an opportunity to close our airspace a bit early and delaying the outbreak of COVID-19. Otherwise, we don't have established regional disease surveillance and control centers within the country that is able to, predict the patterns and everything as we have. And as such, I will qualify, even though it's not unique to Kenya, that early warning systems has not been largely effective as it applied to most of the other global countries. Is not a unique position for Kenya. The second issue that I want to reflect on before I go to the question you asked is the issue of whether or not we were caught flat-footed. And the answer from county perspective, for me, the answer is definite yes. We were caught flat-footed. Because as a country in 21st century, it is critical, to reflect on some basic, standards of preparation that we ought to have. And I look at what is our ICU bed capacity, what is our testing capacity, the issue of stocks of ventilators not being available, the issue of, PPEs not being locally available, among other issues that I see our state of generally, not for COVID-19, but our state of preparation for pandemics was not okay. As a resilient country, we've done fairly well at the outbreak of the disease to try and mitigate. But in terms of whether we were actually flat-footed or not, the county perspective, we are actually flat-footed, you know, when this disease outbreak happened. And we lost some opportunities at the advent of devolution, where there were wrangles between the council and Ministry of Health. Ministry of Health trying to hold on to functions and bureaucracies within the system, delaying the critical role of the ministry, which is you know, the issue of setting standards. And by setting standards, then by now, 8 years down the line, the ministry would have really said the 47 counties would have certain basic standards. The critical role of the ministry, which is, you know,
yes, we can hear you. We can hear you, Governor.
There is a bit of echo. Okay. The ministry would have really say sorry, there's a bit of echo, and I just want to say 8 years down the line, the ministry would have been able to indicate some basic standards that you know, the Ministry of Health will have demonstrated that the 47 county governments will have in terms of ICU beds, HCU beds, and testing capacity.
I just want to jump in here. The echo is actually coming from your end, so perhaps you can just check the connection so that we're able to hear all the points that you're bringing. And maybe while Governor Roby is doing that, we can go back to Honorable Mutai Kagwe. We're receiving some questions coming in, still actually on the point of the spike in cases of gender-based violence, domestic violence during this pandemic. Are there plans to match the acknowledgement of the problem with funding to support prevention and response? And another question that has come in is, can we expect to see more county governments commit to plan and budget for, and even the ministry actually, commit to plan and budget for, you know, shelters and safe houses for sustainability purposes?
Very much. Thank you very much. Let me just, can you hear me?
Yes, I can hear you.
Okay, let me just respond as follows. I think that from what Governor Roba is saying, in terms of county preparedness for emergency responses, as I said earlier, I do believe that we have learned a big lesson in terms of how to respond going forward. If you remember, one of the fortunate, quote unquote, things that we had here is that we have got a very good medical resource in terms of human capacity, because don't forget we had volunteered to deal with Ebola in West Africa, so that whole Ebola team is still here with us. We have got a fantastic set of doctors and nurses who work in this country. But I think that the management of responses is what we must improve on. And that's why I spoke about the policy document on the health emergency response, which is coming the discussion this week, and also the formation of Kenya CDC, so that we have got an institutional framework that can be able to respond rather than just have a ministry. There is an institution that does with public health and has got the infrastructure for a response to those kind of things, including the possibilities of even mobile hospitals and so on and so forth. The second thing has to do with what you said about domestic violence in houses. Yes, it is true. There was a spike up when we announced the curfew. There was a spike upwards in domestic violence, which is something also apparently was happening also in the world as well. And if you remember, the council, the Doctors and Dentist Council of Kenya, led by Eva Jenga and CEO Yubia, went on high gear to try and respond to this issue, not from an enforcement point of view, but from an understandable health condition, and not just the domestic violence, also in terms of mental health, that we have seen an upsurge of mental health issues in the country. This is an area where admittedly we have never really addressed matters mental health properly. If you look at our best facility being Mathare Mental Hospital, and you look at the state of Mathare Mental Hospital, then you can see that it is something that we have not addressed comprehensively. And it is one of the agendas that I've got on my desk to deal with that particular issue. On the matter of shelters and so on, this now will be part of what the national emergency response should put forward. And part of it is within the Kenya CDC. And that's why in terms of the management of the disease and in terms of the management going forward of any other outbreaks that we get, we need a formalized structure that does not currently exist. This emergency, the health emergency response policy and philosophy, coupled with the formation of the Kenya CDC, working with other multi-agencies such as defense, such as agriculture because of food supplies and so on, devolution because of linkages with the county governments. I think this is where we can uplift and improve on what we already have. We have done a lot, but we have had a lot of challenges. But we have also learned a lot. And I think that if we can use the lessons that we have learned, the future pandemics, hopefully none comes, but we can also just sit back and hope and just base our actions on hope. We have got to be prepared. And I think going forward, we will be better prepared as a nation than we would otherwise be. Now, the Kenya CDC envisages a situation where there are regional centers all around the country where we will be acting from. In addition to that, the government we want to start the Mathare Mental Hospital. We want to start working on this. We want to have a huge facility. In fact, the idea that we have is to move it away from where it currently is to better facilities and have also regional facilitation of mental health care. And we're not just talking about people who have gone to perhaps where they must be locked up. We are also talking about regular mental health checks. We are talking about teaching, improving the teaching capacity of our mental health facilitation, but also getting our community and health workers to participate in trying to resolve the domestic violence issues that we are getting. And we are also grateful to the religious community and the spiritual fraternity because they have also been assisting us in dealing with domestic violence and in trying to resolve those issues amicably and teaching our people how to live together, even in spite of the fact that we continue to have this situation with us and we continue to have curfew. But essentially, we also need to understand each other and live in harmony. But yes, we fell short.
I'm there, I think.
All right. Sorry, Honorable Mutahi. This is on our new normal.
I was about to tell him that there is no domestic violence currently happening here. So,
so maybe it's really great to hear you talk about mental health being something that you're actually actively looking at, because even globally, the conversation's being had that after COVID, the next pandemic is a mental health one because of the ripple effects of this pandemic. And so I want to switch back to Governor Ali Roba and just hear your thoughts on a county level. So maybe you can finish your point that was interrupted. I'm so sorry, but sometimes technology does this to us. So maybe you can speak to your point that you were making and also touch on gender-based violence on a county level. How are you handling that?
Thank you very much, Adele. I will finish. Most of the issues have already been captured. I want to reflect that, across the globe, the situation is the same. But nevertheless, for us, as the county level, we were caught flat-footed with a very serious state of unpreparedness with dealing with pandemic of this magnitude. Resiliently, with the help of the President, the Ministry of Health, and other stakeholders, we've managed to have some, very bare minimum response capacity. But this needs to be standardized, and I would like to request MOH to take its rightful role of making sure that certain bare minimum standard of response is developed, including ICU, HDU capacity, oxygen supply system, training of personnel in critical service provision like ICU, building capacities of testing for the 47 county governments gradually. Under the circumstance, the ministry has done very well, but we're only at 12 centers. We need to get all the 47 counties to be able to carry out these tests as required for us to be able to effectively respond. And the issue of rehabilitation centers, and I want to emphasize as I go to the issue of violence and many other issues and mental health, that we need to have properly structured and managed rehabilitation centers for the 47 counties in order to respond at the county level so that Madare Hospital, any other similar hospital at national level does not get overcrowded. And the issue of domestic violence, we need to entrench community surveillance system for us to be able to deal, because as the lockdowns happened, there was a very critical issue that came out that really affected the population, because people remaining in the house together for a long period of time have gotten easily irritated over very small issues that are taking shape. The last issue I want to talk on is the mandate and the critical role of Ministry of Health right now is a lot more clearer. The working relationship between the counties and the ministry is a lot better. There's need to build trust between the two levels of government with respect to Ministry of Health and Service Provision, so that the health sector in the country should be able to have certain basic minimum standard across the 47 counties, so that when these challenges or similar challenges does occur, then we'll be able to respond fairly well as counties. And that is my take. Thank you very much.
Thank you. Thank you so much, Governor Ali. And I have to say a huge thank you to all the panelists who joined us today. We've gotten a lot more insights, especially when it comes to the pivotal point Kenya is at. How do we flatten the curve? We've talked about accountability and how do we ensure that the public has trust in the management of this pandemic. And I really do appreciate that the panelists gave quite a few actionable points. And it's my hope that, the various representatives of government can actually take some of those points and start implementing them so that we can continue to win this war against this pandemic. I also would love to hear more cohesiveness between the county and the national level, because on national level we say we were not caught flat-footed, but counties are saying we were caught flat-footed. So hopefully this conference, because we have county reps and we have people from national government, can be a great place to have these two functions come together and work together so that, as the President said earlier, we bounce forward and not bounce backwards. My name is Adele Onyango, and I really do appreciate you who is listening. Remember, you can send through your questions on Twitter. The hashtag is COVID-19 Conference 2019. And in the next panel, we're going to be looking at the impact of COVID-19 beyond health. And the very brilliant Eric Latif will be moderating that conversation. It's been my pleasure. However, I want you to sit back, relax, and take a look at this video that documents the COVID experience.
Hello. Hello. nitasema chuoni, but magia kwa mezuti huko. Background.
She also is a medical advisor to the University of Nairobi Science and Technology Park. And with it, actually, I probably the team. Let's hear from Dr. Shiro, the medical doctor, to give us an
Hello? Hello? Hello?
sasa tuelekee uwanjani, tuungane Joshua Makori, tuelezee mengi zaidi kuhusu uongozi ama uchaguzi wa FKF.
Jengoiri, niko hapa katika anga na ardhi ya makao makuu ya shirikisho la mpira miguu hapa nyumbani FKF, na leo hii si mbaya kiukweli, ni ya mwisho kabisa ya mwezi huu. Ni kwamba wagombea wa uchaguzi wa FKF upande wa baraza kuu ndo zamu yao kwa sasa wasilisha stakabadhi zao kwa heshima kubwa ya kuidhinishwa na bodi ambayo inasimamia FKF uchaguzi wenyewe.
And this committee focused quickly on looking at the food security situation in light of this pandemic, because we were very cautious that if we don't manage the food security situation and access to food for all Kenyans, especially those in urban settlements, poor urban settlements like Mathare, Korogosho, and Kibera, we are going to have an even bigger crisis than the COVID. If they were not able to access food and water, they were going to come out. They would not respect the containment measures. So the committee moved very quickly and focused on 3 delivery areas. Number 1, food production had to go on. So we had to make sure that whatever needed to happen, food production had to go on. So we developed guidelines quickly to support farmers and counties. Together with the counties, we worked to make sure that food production continued. And it was right in the middle of our planting season. So if we had missed that season, we would really be in big problems, even now beyond COVID. And so we made sure that input suppliers were declared also essential services, so that fertilizer, pesticides, and other inputs, including mechanical implements, could access the farm, and the farmers could work, and workers could access the farm. And this was communicated to the provincial administration and county government very quickly with guidelines to support that. So that was paramount. Food production had to be sustained, because this is dependent on weather, dependent on season, and if you miss a season, then you mess the whole food balance sheet. And we are glad that we succeeded in that, working together with the counties. The other thing was that water availability had to be assured, especially for the informal settlements. And so working with the counties, we made sure that water was made available, and also water service providers provided that for free, especially in the most critical times. And I think this succeeded with some hitches here and there, but largely we had that on focus. The other thing was that those who could not afford food and they had lost their income, they were registered, especially in some of those vulnerable places, under a system that was managed by the provincial administration, and they were given cash transfers. We moved away from physical distribution of food, and we implemented a fast. I think this was the first even for Africa, where we were doing cash transfers, the 2,000 shillings per week for vulnerable households. Of course, there were complaints for those who missed, because sometimes everybody expects to get. But this was an innovation that we can carry into the future, so that in future we know if there is a food shortage or a drought, cash transfer will work just fine. We don't have to move maize around the country like the way we used to do. The cash transfers allow the family dignity and also choice of what to buy. The other thing that we learned, and which we need to learn going into the future, we were churning a lot of data about production, data about food balance sheets for the various value chains, both in the country, in the region, and globally. And so it required serious collaboration with the counties. It requires the ability to employ digitization, digital tools to collect this data and share it and process it and use it for decision making on a weekly basis. And it also required us to mine data from other countries about their production globally. How is the production going on? Will the food supply situation of the world be good? And we were able to reassure ourselves and the country that we will not run into a food crisis. And this practice has to go on. Data collection, data sharing, and data processing using digital tools at the county level, at the national level, and linking to global systems that will assure and guarantee us food security, because we'll know where the food is and we'll know where the shortage is.
Bona PS, thank you very much for the insights that you've shared so far, and I think we may come back at the Q&A session to get a bit more of what you need to share with us. Let's now move on to John Macharia, who's the country director of the Alliance for a Green Revolution in Africa. This is AGRA. And John, you sit at the helm of an organization that basically seeks to ensure that there is food security in the continent of Africa. During this pandemic, there was sort of disruption, of course, in the value chains. What is it that you want to speak of, talking about the sustainability of these value chains, considering and bearing in mind that a lot of our farmers are small-scale farmers in the continent?
Thank you very much, Latif. And first of all is to appreciate the work that the Ministry of Agriculture actually undertook during this COVID period in terms of putting together guidelines and actually putting together the food program, actually coordinated effectively together with the county.
I think, John, sorry, we have a technical issue. We're not able to hear you well. I'll go back to the PS, Professor Boga. Prof, looking at what you were saying, that these are some of the lessons that we've learned, and are there any policy or legislative measures that need now to be put in place that the Ministry of Agriculture is thinking of that could ensure that if we look into the future, we will be better prepared?
Yes, Eric. In order for doing what we did and coordinating, we created what was known as the Food Security War Room. And the Food Security War Room comprised of ministry, private sectors, development partners, research institutions. Everybody was linked, and we were having weekly conversations about particular problem areas for food production. And I think this is a practice which we are now transitioning the Food Security War Room into the Agricultural Transformation Office to exactly continue doing that, linking better with the counties, linking better with farmers, linking better with the private sector, so that the challenges that we are going to face bind team, well coordinated, so that the issues can be addressed from all dimensions. And we expect more challenges because in the middle of the crisis of COVID, we also had locusts. So we also had to manage the locust crisis as we were managing the COVID crisis. So we were managing two crises. And at the same time, a third crisis came was the floods. And the floods also impact on food production. And so because we were working together with the counties and other stakeholders in this food security war room kind of situation, we were able to respond to all these crises, even as they evolved and threatened to affect the food security situation in the country. But as you can see, we were able to come through. And I think the systems that we have put in place have to be strengthened, especially at the county level, so that in future we don't have to reinvent the wheel and we are able to manage crisis. In the agriculture sector transformation and growth strategy, and in the agriculture policy, we have sections that deal with crisis management because we are anticipating with climate change that crisis will be a way of life, and we need to make it normal to deal with crisis for the agriculture sector in the country, and also dealing with our partners in the region, because our food balance sheet is a shared food balance sheet with the other countries in the region.
All right, so let's try and see if we have John Macharia in a better line now. John Macharia is the country director for the Alliance for a Green Revolution in Africa. John, let's try to hear you now. You had started raising the issue of what we can do to ensure that we don't face a similar situation in the future.
Thank you very much, Latif. I hope I'm clearer now.
You're much better, yes.
Yes, I actually started by saying that we really congratulate the Ministry of Agriculture for the fast action they did in actually putting together the Food Security War Room that ensured that there was effective coordination between the government, the national government, the county government, private sector and development partners in trying to respond, to matters food and agriculture and in relation to COVID. I also wanted to express our appreciation to the counties that actually kept the markets open and actually ensured that farmers were not only supplying food to the markets, but also consumers in Nairobi and other urban markets were actually able to procure food. In terms of thinking about a paradigm shift, I think I want to start by saying that we need to actually think about building resilient food systems as opposed to value chains. Because one of the things that the COVID pandemic has shown is the interrelatedness between, a disease, our health, food, education, and the infrastructure that we're putting together. And it's instrumental to know that, the counties have put down a lot of hard infrastructure, but there's a lot of soft infrastructure that is also required to help us actually have a food secure country. And what I mean by a soft infrastructure in this case, I wanted to say this. In the last century, it was really about an agricultural transformation. We've seen investments being put together towards adoption of improved technology. In Kenya, our maize production is about 1.5 to 2 metric tons per hectare. We have an adoption rate of about 30 to 40 kilograms of fertilizer. However, in terms of the potential